My name is Syndee Givre. I'm a board-certified ophthalmologist with fellowship training in neuro-ophthalmology. I'm part of a large private neurology group in Raleigh, North Carolina, where I exclusively practice neuro-ophthalmology. I've been practicing full-time neuro-ophthalmology for close to 20 years and see patients who have problems affecting their optic nerves or brain or neurologic problems that affect their vision. A large part of my practice is assessment of visual pathway function, and probably the most sensitive tool for this is visual field testing, so I rely very heavily on perimetry to diagnose conditions, to determine the anatomic location of pathology. I use serial visual field testing to follow patients who have vision-threatening conditions, and also use serial visual field testing to monitor how well treatment is working in my patients. My first thought when I was asked to consider the Optopol was that I had used the Humphrey since day one of training and throughout my career as an ophthalmologist, and any alternative perimeter was going to have to be very carefully examined before even considering it as an alternative to the Humphrey. The technicians had concerns about switching to the Optopol after having tested for decades on the Humphrey, but in reality, the switch was easy. Many of the tests that I've been using are similar to the tests that were used on the Humphrey in the past. And I've had time to read and use technical support to be able to add new tests to my practice, which were not available on the Humphrey. And I think I'm probably just using a fraction of what is available. I've had the opportunity to use the Optopol to test a number of long-standing patients who have been tested on the Humphrey for months or even years, and I found the results of the Optopol to be very comparable to the results of the Humphrey. I've had the Optopol long enough that I've had patients come in multiple times to test on it, and the results have been repeatable. And on new patients, I found the results to be consistent with the pathology. What's appealing to me about the Optopol is the versatility. The testing parameters and algorithms can be modified to meet the needs of the doctor or the patient. And I also like that it's PC-based, because that makes upgrading and maintenance hassle-free and even virtual.